Fran Odette is a feminist and disability rights activist for over 25 years, with a focus on the intersections between gender, disability, and sexualities. Fran brings a wealth of knowledge on the issues for survivors of gender-based violence through her research, writing, and programming in agencies working to end violence against women. Fran worked in services focused on gender-based violence, with a particular focus on violence against women and children with disabilities. In addition, Fran has been involved in working on issues related to disability and sex positivity, providing training to sexual health providers and people with disabilities. Much of Fran's activist work has been in collaboration with agencies that work with marginalized communities, including engagement and collaborative work within women's shelters, homeless shelters, legal and counseling services in the GTA and across the province. As a trainer and educator, Fran's work has been supporting service providers in building capacity to make the linkages needed to ensure that persons with disabilities, inclusive of gender identity and sexualities, to have access to services. Fran co-authored with Corey Silverberg and Dr. Miriam Kaufman a book entitled The Ultimate Guide to Sex and Disability for all of us who live with disabilities, chronic pain, and illness. That was from Cleus Press. Fran teaches at George Brown College since 2008 and is faculty in the Assaulted Women and Children Counselor Advocate Program in the Social Service Worker Program. She co-developed and teaches 2 critical disability issues courses entitled Disability Discourse, The Experienced Life, and Discourses in Disability, Implications for Social Service Worker Practice. So today, Fran's talk is titled Centering Our Work in Disrupting Ableism, Beginning Conversations. I'm just going to do a brief intro on this talk and then I'll give it to Fran. So doing anti-oppression work where diversity and inclusion are key themes is important to center communities that experience exclusion and segregation beyond the appearance of performance, but with intentionality. Ableism speaks to experiences of disability, oppression at the individual, community, and societal levels. Fran will create spaces to get us thinking about the ways we, as providers, can dismantle the structures that contribute to the barriers that are experienced as disabling for persons with disabilities. We'll explore where the problem of disability lies, to move away from the individual and instead focus on and dismantle the environment, systems, and attitudes that create the barriers so as to ensure meaningful and sustainable change. So really looking forward to this. Please, Fran.
Great. Thanks, Omar. I wonder who that person is that you just introduced, but in the meantime, I'll take over until she comes back. Welcome, everyone. And we have a sort of short time together. And I really did just see this as, I think Sri and I talking about this earlier, is a beginning conversation. Typically I do this kind of work in full day sessions. So I'm not sure that we will have solutions at the end of our time together at 5, but I do hope that there will be a continued interest to work on this after today. I am just wanting to be clear that I'm a white, queer, disabled settler, and that I come to this work also recognizing my own need to make commitment and acknowledge the systemic oppression that has faced Black and brown bodies living with and without disabilities, and hope that we will also bring that into our discussion. So I really just wanted to chat with you a little bit about this idea of ableism and, have you think more critically about what's going on in your agencies and how we can start disrupting sort of typical or the dominant narratives that exist around disability and service provider programming. So ableism is a product of capitalism, and that we have very particular ideas of what it means to perform and what it means to produce. And we know that really not all of us are going to be able to match these, what are, I think, quite unrealistic expectations around productivity. But what does that mean then when we're not able to do that? What does that mean as a coworker? What does that mean for someone who's coming into a program and they're not able to actually meet the criteria of that program, not because they're not interested or committed, but the program has been set on very specific criteria that doesn't really think about the range of experiences that people bring. Yeah, I want to just kind of go back. So, thinking about disability as something that is visible, and we know that so many people are living with invisible disabilities. I think oftentimes people think disability is something that gets acquired at birth, and it really is a very small percentage of people who acquire disability at birth, where it's mostly, if you're lucky enough to grow old, you will acquire a disability. If you are able to experience good health care, access to education, and access to resources, you are less likely to experience disability. So thinking about sort of the broader structural issues that contribute to disability and or illness is something that we want to think about as well. And I think, yeah, Nora, you spoke about centering the abled perspective as normal. Absolutely. I mean, I think that's what ableism is about, is the assumption that we all want to move through the world as non-disabled. And I want to have us sort of shift this thing about the terminology around able-bodied and non-disabled, because able-bodied presumes that people with disabilities don't have ability. But instead, we want to think about non-disabled versus disabled. Because I have lots of ability. I just may not, ascribe to the dominant narrative around what it means to be non-disabled. But I still can do lots of things. I may just do that differently. And so thinking about language as a way to also sort of describe people's experiences is an important part of unpacking what ableism is. Any other thoughts for folks? In your programs, if I can be so bold, is to ask you, is there something that you are thinking about in your programming or in the design of programs that might actually be creating barriers rather than being inclusive?
One thing I definitely see is just assuming that everyone can come to the program, right? Like I've run programs where some people couldn't make it, and for various reasons, the timing didn't work, and it took a lot of work to reframe things and rework things so that everyone could be there in the way they could. But that's I think the challenge is can be a very expensive thing to do, to make those changes, and I remember in this one particular case, the funder was like, sorry, we won't support you to make the changes you need to do that. It was just too much. And so that, I remember that being a big challenge. And so then thinking about that ahead of time. So, yeah.
Ooh, so I have something that can I be bold? Because you may never have me come back, but I think that's ableism. That's absolutely your funder who is unable to see who this program is for. And I think that our job is to actually push back. We are making lots of assumptions that people who are coming to our programs are not dealing with, you know, COVID related issues on top of, you know, trauma. Omar, you work with newcomer immigrant communities, and we know that for many folks, there are experiences around trauma related to migration. And we aren't thinking about the fact that that experience can lead people to not be able to uh, engage in the sort of narrow definitions around programming. And so that's a conversation to have with the funder to say, hey, listen, if we're really trying to meet the needs of diverse communities, we actually maybe need to be thinking about this differently than how we have currently been offering programs. So that we are thinking about inclusion in much more meaningful ways than just having, you know, us meet numbers. And I'm sorry that I'm sort of talking to you, Omar, but I'm saying that to all of you in terms of your programming and thinking about who's not there. That is also a form of ableism. Who is not able to access it because of the restrictions that perhaps the city has created. We know that the city is also, you know, really struggling to think about responses that are much more meaningful and inclusive than currently has been offered. And I also want to sort of think about, as you want to contemplate a case to support new learning from funders and you know, folks that are providing supports to your programs, is that there's this perspective around different ways of thinking about disability. So ableism is very much thought of in this medical model. So the medical model sees disability as something to be fixed, something that must be cured, that people's lives are tragic, and that the gatekeepers are people who are family, but also service providers who will make the determination of whether someone can or cannot participate in a particular program based on a person's experience or diagnosis. So that is really thinking in very sort of narrow perspectives around disability that has had a long legacy. I mean, you know, we think of ODSP, we think of Wheel-Trans, we think of, you know, access to other kinds of programs where the designation to be able to participate is determined by a doctor. Right? So that doctor actually gets to maybe see that person, if we're lucky, 10 minutes. And suddenly then that doctor is the person who will make a determination as to whether that person can participate or can access the supports. And so that's where the medical model has a very long history, and is also part of what ableism is about, is supporting this perspective. If we actually shifted the focus away from seeing the problem of disability within the individual and actually saw the problem of disability within the environment, we can make change. So the environment and, you know, the physical, the social environment has barriers that contribute to people's feelings of exclusion. We know that just not only around disability, but we also know that around other experiences of oppression. Looking at systems that contribute to the status quo and ensure that people don't have a lot of movement outside of those sort of very narrow definitions of what it means to be whoever. And I think that's what the medical model also is supporting, is the fact that we aren't resting our experience in the individuals who know best, which is the individual with the disability or the lived experience, but really seeing that someone else is making that determination. So a social model of disability would see that stairs are the problem to get into your center, not the person with the disability who can't access those stairs. So structurally looking at the built environment, but also looking at, intake forms, for example. Are our forms asking people to tell us what would make a difference for them to participate in the program? What would they need to be able to participate, rather than us determining that for them, or having someone who maybe, has very limited access to what their lived experience is like, making those determinations. So, I think what's really interesting about the conversation around disability oppression is that it is the one experience of oppression that does not discriminate, right? That any one of us can experience disability. After this call, not that I am trying to say anything, but, after this call, you might go out to your car and you might, your ankle might twist as you go down onto the driveway. And then now you have a temporary disability. So really what I want us to think about is that, I don't know who's in the room. I don't want to make assumptions, but what we want to think about is coming to this conversation that many of us are temporarily able-bodied. That it really can change in a minute. And I'm not saying that for, to raise fears for you, but we don't talk about this in our lives until someone in our life experiences it. And then it's like, oh, okay. So, how do we prepare to create opportunities for people to come in where, and again, the social model is also coming from the assumption that you are going to have disabled people in your space. And what you want to do is actually create it that no one knows. You want to create inclusion so that no one has to feel like they have to explain their situation in order to be able to come into your space or to get the supports that they need. It's just going to happen.